This morning, we have our latest installment in a series from Rochester Regional Health on care that you should not be skipping during the pandemic. Today's guest is Dr. Dan Alexander. He is an orthopedic surgeon with Rochester Regional Health's Finger Lakes Bone and Joint Practice. Dr. Alexander, good morning to you.
Good morning. How are you?
I'm doing well. It's good to have you here. I know a lot of surgeries initially got postponed at the start of this pandemic. So tell us where we're at right now in terms of proceeding with these types of surgeries.
I think at this point it's extremely safe to have an elective procedure. I tell my patients that really because of COVID, we've improved on a lot of already safe practices. And the hospitals and the ORs are cleaner than ever. COVID is controlled in the hospital settings, and I think it's very safe to have an elective procedure at this time, maybe the safest ever.
Yeah, just because of all the protocols in place right now.
Correct.
When we talk about joint pain or anything like this, people can tend to put that off, to push it aside. Why is that a bad idea?
Well, I think that if a patient is in pain and they've failed all conservative measures, physical therapy, anti-inflammatories, cortisone injections into the joint, and they're still suffering, I think it's important to see the orthopedic surgeon and discuss further treatment options, which could be a joint replacement. Joint replacements are a game changer for most patients. 95+% of the time, patients have an improved lifestyle, and it's really important that if you're suffering, you take care of the joint. With our technology, where it's at, especially with robotic surgery, which has come to Rochester Regional Health system, I think it's important that the patient comes in, gets evaluated, and talks about options, including the joint replacement. Joint replacements change activities of daily living for the better.
Yeah.
Many times these people are suffering. They can't climb stairs. They can't do their normal daily routine in their home. Sometimes just standing to wash dishes causes them serious pain. And joint replacements really take care of that problem for most patients.
We actually recently highlighted that robotic surgery that you mentioned. For people who may be fearful of consulting an orthopedic surgeon, whether it's one reason or another, whether it's COVID, or just the fear of taking that next step, what do you say to that person out there watching?
I would say make the phone call. Come in for an appointment and just discuss matters. Not every appointment leads to a surgery, thank goodness. We, again, try to treat people conservatively as long as possible. Joint replacement would be the last step after conservative measures have failed. And it doesn't hurt to just come in and talk to the surgeon and discuss the treatment options, which could include a joint replacement.
And it sounds like common sense, but maybe you could just reiterate for folks, if you are in pain, it does not have to be that way, right?
It does not. Joint replacement surgery, even in the face of COVID, is safe and extremely effective. It, again, is a game changer for most people who have total hips, total knees, total shoulders, etc.
Dr. Alexander, really appreciate your time this morning. Thanks so much for coming here on Good Day Rochester. Thank you.